We're continuing to talk about exercise and diabetes. There was a fascinating session today, Is Exercise Medicine? And I'm delighted to welcome Dominik Pesta. Now, you were in that session and you were particularly talking about responders and non-responders to exercise. And why we've got you back into the studio is because we wanted to know what the practical advice that your research throws up for diabetologists to advise their patients. So let's start at the beginning. What kind of exercise should people with diabetes be doing?
So it's well established today that exercise has many beneficial health effects, multi-organ effects on muscle, adipose tissue, on the liver. And this can be acquired by aerobic exercise, which involves walking, but also aerobic exercise like biking or swimming exercises, as well as resistance training, which improves, besides the metabolic function, it improves also your muscle mass. And your muscle mass is like your motor. It's very important for glucose disposal. And if you lose your muscle mass, you lose your ability to take up the glucose. That's why the muscle mass is so important. And the muscle mass you can only really retain with strength training. That's why it's so important. And also, type 2 diabetic individuals tend to be sarcopenic, so they lose muscle mass more and faster with age. And there also resistance training is a beautiful countermeasure for that. But what has been actually shown is most beneficial is a combination of the two. And that's also related to the guidelines, the ADA guidelines on physical activity and exercise. If you combine resistance training and aerobic training, you have the highest benefit from those two with regard to metabolic endpoints.
So are we talking of this for both type 1 and type 2?
So it's always neglected, and people forget that, of course, exercise is mainly prescribed to individuals with type 2 diabetes because it's a metabolic-related disease with obesity-related and so on. But also type 1 diabetic individuals will profit from exercise. They will profit by strengthening of the cardiovascular system and about their muscle mass. So that's equally important and should not be forgotten.
Now, for type 1 diabetics who may well be in your age range bracket, and I'm guessing that you do some exercise yourself, how about the kind of exercise regimes that are appropriate for type 1 diabetics? I mean, I'm guessing you perhaps do some strength and some cardio work. Is that the kind of regime that a type 1 diabetic can take on?
Yeah, definitely. So, start out with mild aerobic exercise and then combined with strengthening exercises, aerobic exercise in the range of 60 to 80% of the maximal oxygen consumption of the maximal aerobic performance, so to say. But also high-intensity interval training has been proven to be beneficial, which is a training where you have different intensities ranging from low intensity to high, and this is intermittent changes. But I think what's also important, people should not forget about balance training and about flexibility training, and this is too often forgotten. Because both are very important, for example, in order to prevent falls for people, for elderly people. So that's very important. And if you specifically talk about exercise in type 1s, one issue that has to be addressed is the risk of hypoglycemia. So you need to adapt your insulin dose, and you also need to adapt your carbohydrate intake. That's something to be kept in mind.
So that's really useful advice. And I can see you writing a handbook. I think a handbook for people with diabetes about the types of exercise, which actually could also go to instructors in gyms, because I think often instructors in gyms are the ones that are advising people what exercise to do, and I sometimes think they don't have any clue as to what to do with people with diabetes.
I agree. There is a missing link, I think, sometimes between the science and the practice side. So the scientists know very well what stimuli increase the glucose uptake in the muscle and in different tissues, improve insulin sensitivity and so on. And the coaches, they exactly need how to train with elite athletes. They know how to train with healthy individuals also, but they lack often the combination of the knowledge that regards the metabolic disease and then the right targeted training to improve their outcomes. So I think there is sometimes a missing link, and you're totally right. There's work to be done in that direction. Yeah.
Well, thank you very much, Dominik. So if anyone is listening out there in EASD land who would like to put together a book for either people who are coaching those with diabetes or for people with diabetes who want to do exercise, be they type 1 or type 2, Dominik Pesta is the man to go to. And you can see all of that session, as I've mentioned before, on EASD.org.